Welcome back to the Global Interview Institute. This is part 2 of our comprehensive guide to Band 5 nursing interviews in the UK, continuing with 20 more crucial questions covering topics such as handling disagreements with colleagues, ensuring effective handovers, managing stress and well-being, clinical governance, patient safety, and supporting patients with specific needs. If you haven't watched part 1 yet, I recommend checking it out first, as together these videos give you a complete toolkit of 40 interview questions and winning answers to help you succeed in your Band 5 nursing interview. Let's dive into the remaining questions. Essential interview questions and sample answers, continued. Question 21. How would you handle a disagreement with a colleague about a patient's care? Sample answer. When facing a disagreement with a colleague, I'd approach professionally, focusing on the patient's interests rather than personal differences. I'd suggest discussing privately, seeking to understand their perspective using open questions before clearly articulating my concerns based on evidence-based practice rather than opinions, using I statements and specific observations. If we couldn't reach agreement, I'd suggest consulting relevant guidelines or policies together. For significant clinical disagreements, I'd involve a senior team member while maintaining collegiality. I believe respectful disagreement can strengthen team practice when handled well, as it encourages critical thinking and patient-centered decision-making. When you subscribe, like, and share this video, you're not just improving your career, you're changing lives. A portion of our proceeds supports vulnerable children worldwide. Act now. Be part of something meaningful. Now, let's move on to our second interview question. Question 22. How do you ensure effective handovers between shifts? Sample answer. I ensure effective handovers through a structured approach using the SBAR framework for each patient, highlighting current status, background information, recent investigations, outstanding tasks, specific risks, and any concerns from patients or families. I prioritize patients by acuity, discussing unstable cases first, avoid jargon that might be misinterpreted, and encourage questions from oncoming staff. For complex cases, I offer to accompany the oncoming nurse to the bedside for joint assessment and patient introduction. I view handover not merely as a task but as a critical safety intervention, ensuring essential information is accurately transferred between shifts, maintaining safe and coherent patient care. Self-management and development questions. Question 23. How do you manage stress and maintain your well-being while working in a busy clinical environment? Sample answer. I manage stress through workplace strategies and personal well-being practices. At work, I use effective prioritization techniques, recognize when I need support, and practice self-awareness of early stress signs. I maintain clear professional boundaries, ensuring I take allocated breaks to rest and recharge, which I find essential for sustained performance. Outside work, I maintain a structured routine including physical activity, adequate sleep, and nutrition. I use reflective practice to process challenging situations and access formal support mechanisms when needed. This balanced approach allows me to provide quality care while remaining resilient in a demanding profession. Question 24. Describe a clinical skill or area of practice you've improved recently. How did you approach this development? Sample answer. Recently, I improved my skills in managing patients with dementia who exhibit challenging behaviors. I approached this systematically, using multiple learning resources, completing e-learning modules, reading guidelines, and attending workshops while observing experienced colleagues. I developed a personal action plan with specific goals and requested feedback on my implementation. This development not only enhanced my skills but improved patient experiences and reduced the need for chemical restraint. I've continued evaluating my practice in this area, noting significant improvements in my confidence and effectiveness. This process reinforced my commitment to continuous professional development and its direct impact on patient care. Question 25. How do you keep your clinical knowledge and skills up to date? Sample answer. I maintain current knowledge through a structured approach, regularly accessing evidence-based resources like NICE guidelines and relevant journals. I actively participate in mandatory training and seek additional learning opportunities, using the NMC revalidation process as a framework for ongoing development, maintaining a detailed portfolio of learning activities and reflections. I value practical skill development and participate in clinical supervision to discuss challenging cases. I apply reflective practice to identify knowledge gaps from clinical experiences, then seek specific learning to address these areas. I believe maintaining current knowledge directly impacts patient safety and care quality. Question 26. Give an example of how you have demonstrated leadership in your nursing practice. Sample answer. As a Band 5 nurse, I demonstrated leadership by improving our discharge planning process. After noticing medication delays on discharge days, I documented specific patterns and proposed a discharge planning checklist triggering medication requests 24 hours before anticipated discharge. With my manager's support, I led a small working group to develop and test the checklist, coordinating meetings and incorporating feedback from resistant team members. After implementation, we achieved a 40% reduction in medication-related discharge delays. This project demonstrated my ability to identify problems, develop collaborative solutions, implement change, and evaluate outcomes, key leadership skills that don't require a formal leadership position but contribute significantly to improving patient care and organizational efficiency. Question 27. How do you respond to feedback about your practice, particularly if it's constructive criticism? Sample answer. I view constructive feedback as essential for professional growth and improved patient care. When receiving feedback, I maintain an open, non-defensive mindset, focusing on learning rather than feeling criticized. I actively listen to understand specific concerns, ask clarifying questions if needed, and thank the person for their input, recognizing that offering constructive criticism often requires courage. I reflect on the feedback objectively, then identify specific actions to address it. For example, when told my handovers could be more structured, I researched best practices, adopted the SBAR framework, and requested follow-up feedback to ensure improvement. Responding positively to constructive criticism demonstrates professional maturity and commitment to ongoing development. Question 28. Tell us about a mistake you've made in your nursing practice and what you learned from it. Sample answer. Early in my career, I made a medication timing error, administering an antibiotic late due to poor task prioritization. I immediately reported it, completed an incident report, and monitored the patient for adverse effects. I developed specific prevention strategies, using a structured prioritization system, wearing a "do not interrupt" tabard during medication rounds, and requesting assistance when facing competing priorities. This experience taught me that mistakes provide valuable learning opportunities and responding constructively to errors defines professional integrity. It reinforced the importance of transparency, accountability, and systematic thinking about error prevention, which I now apply to all aspects of my practice and share with junior colleagues to promote a positive approach to error reporting and prevention. Patient-centered care questions. Question 29. How do you ensure patient dignity and privacy in your daily practice? Sample answer. I ensure dignity and privacy by addressing patients by their preferred name, using screening curtains properly, explaining procedures before starting, obtaining consent, and exposing only necessary body areas during care. I'm mindful of confidentiality in conversations, avoiding patient discussions in public areas, and maintaining confidentiality with patient information by securing records and positioning screens away from public view. I recognize dignity extends beyond physical privacy to include respect for personal choices and cultural needs. By consistently applying these principles, I create an environment where patients feel respected and secure, which is particularly important when they're vulnerable due to illness and directly impacts their emotional well-being and overall experience of care. Question 30. How do you involve patients in decisions about their care? Sample answer. I implement shared decision-making by establishing what matters to the patient, providing clear information tailored to their understanding level, and explaining available options in balanced terms. I create genuine opportunities for questions and check understanding by asking patients to explain their interpretation, respecting their expertise about their own bodies and lives. For patients with communication difficulties, I adapt my approach using appropriate tools and involve family when appropriate. This collaborative approach improves treatment adherence, increases satisfaction, and honors patients' right to be active participants in their own healthcare rather than passive recipients of professional decisions. Question 31. How do you support patients with communication difficulties? Sample answer. Supporting patients with communication difficulties requires a personalized approach based on the specific nature of their difficulty. For language barriers, I use professional interpreters. For hearing impairments, I ensure good lighting and speak clearly. For cognitive impairments, I use simple language and check understanding regularly. For speech difficulties, I demonstrate patience and utilize tools recommended by speech therapists. I document effective strategies in the care plan, involve family members who know the patient's communication patterns, and maintain dignity by addressing the patient directly even when using interpreters. This ensures all patients can participate meaningfully in their care regardless of communication challenges, which is essential for providing truly person-centered care. Question 32. How do you address the cultural and religious needs of diverse patients? Sample answer. I address cultural and religious needs by sensitively asking about specific requirements that might affect care, ensuring dietary preferences are documented, respecting modesty requirements by offering same-gender caregivers when possible, and remaining knowledgeable about religious items of significance. I'm mindful of cultural differences in communication styles and use professional interpreters for important conversations. When facing unfamiliar cultural practices, I approach with respectful curiosity rather than judgment, seeking education from appropriate resources. By incorporating cultural competence into my practice, I provide truly person-centered care that respects diversity and enhances therapeutic relationships with patients from all backgrounds. Clinical governance and patient safety. Question 33. How do you contribute to maintaining patient safety on your ward? Sample answer. I contribute to patient safety through systematic practices and a safety mindset. I adhere to medication protocols, implement infection control measures, conduct thorough risk assessments for falls, pressure damage, and VTE, and maintain accurate documentation that clearly communicates patient status to the team. I use structured communication tools like SBAR when escalating concerns and participate actively in safety initiatives. I maintain situational awareness during busy periods, prioritizing safety-critical tasks and speaking up about potential safety issues regardless of hierarchy. I report near misses and incidents promptly, focusing on system improvement rather than blame. Through this comprehensive approach, I contribute to a culture where safety is viewed as everyone's primary responsibility rather than an additional task. Question 34. Describe how you would raise concerns about patient safety or substandard care. Sample answer. If I identified safety concerns, I'd take a structured approach balancing urgency with appropriate channels. For immediate risks, I'd intervene directly, then raise my concern with the individual involved if appropriate, using a respectful approach focused on patient welfare. If the concern wasn't adequately addressed, I'd escalate to my line manager using SBAR format for clinical concerns, and if needed, follow the Trust's formal raising concerns policy. I'm aware I can approach the freedom to speak up guardian confidentially if unable to raise concerns through standard channels. I understand my professional obligation extends to external reporting if serious concerns remain unaddressed after exhausting internal processes. This systematic approach ensures patient safety remains the priority while following appropriate professional protocols. Question 35. How do you ensure you practice within your competence as a Band 5 nurse? Sample answer. Practicing within my competence involves continuous self-assessment and boundary recognition. I maintain awareness of my capabilities by regularly reflecting on my practice and staying familiar with my job description, trust policies, and the NMC code. When asked to perform unfamiliar tasks, I assess the risk and seek appropriate supervision rather than attempting it unsupervised. I maintain a professional portfolio documenting my training and competencies, allowing me to clearly articulate what I can and cannot do safely. I recognize that declining to perform tasks beyond my competence demonstrates professional integrity rather than failure, while actively seeking opportunities to expand my competence through training and supervised practice ensures continued professional development. Question 36. How would you implement evidence-based practice in your nursing care? Sample answer. I implement evidence-based practice by staying informed about current best practice through NICE guidelines and peer-reviewed journals. When facing clinical questions, I use the PICO framework to find relevant evidence and critically appraise research before applying it, balancing research evidence with clinical judgment and patient preferences. I contribute to creating an evidence-based culture by sharing relevant research with colleagues and documenting my rationale for clinical decisions. I remain open to adjusting my practice as new evidence emerges, recognizing that healthcare knowledge continually evolves. This approach ensures my practice remains current, effective, and aligned with best available evidence while respecting individual patient needs. Specific clinical knowledge questions. Question 37. What would you do if a patient's oxygen saturation suddenly dropped from 98% to 85%? Sample answer. For a sudden oxygen saturation drop, I'd implement a systematic ABCDE approach. First, I'd check if the reading is accurate, then immediately increase oxygen therapy and position the patient to optimize oxygenation. I'd quickly assess for causes using the ABCDE framework, checking airway patency, respiratory effort, circulatory status, and other concerning signs. I'd calculate the NEWS2 score, escalate appropriately using SBAR, and continue monitoring while preparing relevant emergency equipment. Throughout, I'd maintain a calm approach while efficiently addressing this significant clinical concern, documenting all findings, interventions, and the patient's response to ensure continuity of care and appropriate follow-up. Question 38. How would you recognize and respond to clinical deterioration in a patient? Sample answer. Recognizing deterioration involves active surveillance through regular observations and awareness of subtle changes. I monitor vital signs trends using NEWS2, being alert to increasing oxygen requirements, rising respiratory rate, consciousness changes, and reduced urine output as early indicators. I also pay attention to subjective signs like a patient just not looking right, and take family concerns seriously. When I identify potential deterioration, I respond systematically using ABCDE assessment, calculate NEWS2 score, and communicate concerns using SBAR. I implement appropriate interventions within my scope while awaiting medical review, recognizing the importance of early escalation rather than waiting for multiple parameters to deteriorate, as this significantly improves patient outcomes. Question 39. How would you support a patient with dementia who is distressed and refusing care? Sample answer. When supporting a distressed patient with dementia, I recognize their behavior as communication rather than non-compliance. I adopt a calm demeanor, approach within their field of vision, and investigate potential causes of distress like pain, environmental factors, or unmet needs. I use simple, direct communication, validate their emotional experience, and utilize personal information about their history and preferences to personalize my approach. For essential care, I try breaking tasks into smaller steps and offering choices to provide a sense of control. This person-centered approach recognizes that responding with empathy rather than control typically leads to better outcomes for both the patient and healthcare team, preserving dignity and reducing the need for chemical or physical restraint. Question 40. What nursing interventions would you implement for a patient at risk of pressure damage? Sample answer. For pressure damage prevention, I conduct thorough risk assessment using validated tools like Waterlow or Braden scales and develop an individualized repositioning schedule based on the patient's risk level. I select appropriate pressure redistributing devices, implement effective continence management to minimize skin moisture, and monitor skin condition at least daily, documenting any changes and escalating concerns promptly. I involve the patient and family in care planning and work collaboratively with the wider MDT, including physiotherapists and tissue viability specialists. This comprehensive approach balances physical interventions with patient involvement, recognizing that prevention is far more effective than treatment and significantly reduces patient suffering and healthcare costs. Congratulations! You've now completed our comprehensive guide to all 40 Band 5 nursing interview questions and answers for UK jobs. Combined with Part 1, you now have a complete toolkit to help you prepare for your interview with confidence.